Hi, I'm Brianne Grogan, and I'm a doctor of physical therapy. And for the last 20 years, I have been studying and working with the human body. And for the last over 13 years, I've been specifically focused on the pelvic floor and pelvic health. In this period of time, I have helped thousands of women in person and also online restore and recover their pelvic health. This has ranged from people dealing with prolapse and bladder leakage to feelings of pelvic pain and tension and even the inability to have sex. Now, if you are somebody who's dealing with symptoms such as pain, achiness in the pelvic region, sometimes even manifesting as low back pain. Maybe you feel like you always have to go to the bathroom. You always have to pee. Like you might feel like your bladder is the size of an acorn. You may be dealing with pelvic tension. If you have painful sex or a hard time putting in a tampon or keeping in a tampon, that's another symptom of pelvic pain and tension. And also, if you feel like you do Kegels because you think that's what you're supposed to do, you're supposed to do those isolated pelvic floor muscles that everyone's always talking about, but you feel like no matter how many you do, your symptoms just get worse, then I'm here to tell you that tension and hyperactivity of the pelvic floor muscles might actually be your problem, and Kegel exercises are likely making things worse. By working first on releasing and relaxing the pelvic floor, I have helped women with pelvic pain be able to have intimate relationships with their partners again. I even helped a woman be able to conceive her baby. I was so gratified and humbled to see her child come into the clinic 9 months later because she was finally able to have sex with her husband for the first time ever. I've also helped women realize that the symptoms that they're dealing with are actually not related to UTIs that recur over and over and over again. Sometimes people were being put on antibiotics and medications for symptoms, and these were not helping at all. Oftentimes, cultures would come back negative, but they'd be put on a trial of antibiotics just in case. Well, in many cases, it's actually hyperactivity of the pelvic floor muscles. So this is not to say that you should just focus on relaxing the pelvic floor. Of course, always go to your physician, get a full workup done. There are things that need to be screened for certain. But if you're thinking that maybe you are somebody who's actually dealing with excess pelvic tension, maybe you have some of those symptoms I mentioned, or maybe you keep getting referred to antibiotics and nothing is helping. If this sounds like you, then there are things that can be done to help. First off, seeing a women's health physical therapist, a pelvic floor physical therapist, is so essential. And I've used my knowledge and experience and expertise as a trained women's health physical therapist to create a program that is fully guided, therapeutic, 12-week holistic program that you can do from the comfort of home. Overcome Pelvic Pain for Women is a brand new, fully guided, no guesswork required program that takes you through 12 weeks of a holistic framework, including weekly healing routines that relax and then rebuild muscle groups safely over time. We also focus on mindset shifts. These are so important, between monthly challenges for your mindset and weekly focus phrases that really put you into a better mental state, because the mind, body, and spirit are completely connected. You cannot separate them from one another. There's also nutritional guidance and focus on trigger point release that you can do on your own, and deep relaxation poses that get you into a meditative, deeply healing, deeply therapeutic state. Overcome Pelvic Pain is something that I am so proud of creating. I really put all of my efforts into this program to create a truly holistic, guided program for you. I am proud to offer it. If you are interested, please check the video notes below. And no matter what, whether you choose to look into Overcome Pelvic Pain for Women or not, know that there is hope and there is help. And if you think that Kegels may not be the answer for you, you're probably right. So listen to your body. You are the expert of yourself. I empower you to believe that you can get better, to believe that you can heal, and to look into the resources that are out there for help and support. You've got this. Until next time, remember, eat clean, move every day, and you will shine brighter. And again, please check the notes if you'd like links and resources to help.